See, people are getting final seats. I want to welcome everyone. My name is Kathy Sikansky, and I'm Director of the Graduate and RN to BSM programs here at LaSalle. And on behalf of all the faculty and staff of the school, I'd like to welcome our students, alumni, colleagues, and members of the community who have joined us for this very special 25th Distinguished Lecture here at LaSalle. If you happen to attend the graduate poster session that preceded this event, I hope you were as impressed as I at the scholarship of our students. These students represented our adult and family nurse practitioner students, our clinical nurse leader, nursing administration, public health, and wound ostomy and continence programs. Please join me in congratulating these students for their excellent work. They represent a true commitment to excellence in both teaching and learning. In addition, I would like to thank the faculty, staff, and students who have assisted us in planning of this event. We couldn't have done it without you. Before we begin our much-awaited event, I would just like to take a moment to ask that you kindly silence your cell phones and pagers. And for those of you who have registered to receive contact hours, a program evaluation and your certificates will be emailed to you within the next week. There will also be an opportunity at the end of the lecture to ask questions of Dr. Watson. So without further delay, it is my pleasure and honor to introduce Dr. Zane Wolf, Dean of the School of Nursing and Health Sciences, who will introduce our distinguished guest.
Good evening and welcome to LaSalle, to our colleagues and our students. Welcome to LaSalle University, Dr. Watson. Jean Watson's name and work are known to nurses and other healthcare providers across the world. The reasons for her reputation are obvious and linked to her character and passion. Jean has been explaining the role of caring in nursing and healthcare since the late 1970s. In addition to her sustained record of publications and presentations, Jean has educated many of us during one-to-one and group sessions whereby we have reflected on, studied, and internalized many of the premises and activities of caring. Dr. Watson has joined the mutual interests of nursing and other health care professional organizations to consider, internalize, and act on the values and processes of Caritas. By taking the work of Abedas Donabedian and other investigators interested in healthcare outcomes to another level, specifically outcomes of caring, she proposed the connection of caring to healing, perhaps a revolutionary notion to some members of the healthcare team. But, true to form, Jean's persuasion was offered as a nurse scholar scientist. The caring healing model of Watson views the person-nature universe as a connected whole, as a unitary consciousness of mind, body, spirit, and nature. Caring potentiates healing, wholeness. But you can explore her body of work yourself. It may take some time, though. This is the second time Dr. Watson has graced LaSalle University with her presence. The first time was in April 1984, when she shared a poetic gift, Dream Time and Sharing the Tears. She charmed the audience, helping a small group in attendance to reflect on Aboriginal myth and metaphor. Dr. Watson will also present a keynote May 31st, 2012 at the International Association for Human Caring Conference at the Hyatt at the Bellevue on South Broad Street in Philadelphia. Similar to Caring Caritas, Jean's influence is not always quantifiable. She will take us with her tonight, sharing some of the conceptions of her caring journey. Thank you for coming to LaSalle University, Jean. Please welcome Jean, one of our rock stars in nursing.
This is a treat indeed, and what a beautiful introduction, Zane. I'm truly touched. And I'm also realizing that it's going to be an interesting experience for me because I speak from my slides, and I'm just realizing I cannot see my slides. So we'll see how this happens and how this goes. But first of all, I want to honor you and your presence and your contributions to this work in our world today, which is so needed. And I often say when I'm doing my courses, which I do these intensives in May every year at the university, that I sit at your feet because you're doing the work. And I feel like I'm somewhat of a mirror to help you to see the beautiful gifts that you offer to humanity every single day. And the scholarship and the manifestations of this work that you're doing here at LaSalle, under the leadership of Zane Wolf and all these wonderful faculty, is really an exemplar for the national and the international trends that we see happening this moment in time. The other way I would like to begin is again with a pause, because no matter where you step into this model, and I sort of know my slides, whether you really enter this as a philosophy, and as a philosophy you would see this as making explicit our orientation toward humanity. That nursing, whether we're aware of it or not, I think we have to acknowledge that we have a covenant with humanity to sustain human caring and healing and health and wholeness, to sustain human dignity, to help to alleviate vulnerability. And we do this in the midst of threats to caring, be those threats biological or otherwise. And we also know, individually and collectively, we're becoming more awake and more aware that nursing has a critical role to play in the world. It's beyond any medical institutional kind of contribution we make, which is grand, but it really is pausing to realize that we have a critical role to play in sustaining humanity around the globe. And it transcends culture and geographic setting and all the behaviors that we may not like. And it really is, we are here now to help sustain the human race in our world today, because caring begins with self and radiates out in concentric circles all the way to the planet, all the way to the universe. So we now know more clearly from eco-caring and the awareness there that we are in danger of surviving. And I'll speak a little bit about one of the philosophers that I'm using more recently, whose name is Emmanuel Levinas, and he's a French philosopher, and he says the only way we can sustain humanity at this point in human history, this time in which we're living, is through the face-to-face connection. Now, that's controversial in the sense of the virtual world, but in terms of us having this connectedness that allows us to face our own humanity and face the humanity of another is one way that we have to pay attention to our connectedness and our unity that we bring to this work. The other thing he says about this connectedness is that we have this ethic of belonging, that we all belong to this infinite field of universal love. And we draw upon that for our source for sustaining our humanity. So when you have the face-to-face connection as an ethic of belonging, that when you face another person, he says, you're looking into the mystery and the infinity of the human soul. And when you look into the mystery and the infinity of the human soul of other, it's mirroring the infinity and the mystery of your own soul. And he also uses this ethics of face and the ethics of belonging. So all of this is underneath this model of caring. And so whether you look and step into this work as an ethic, whether you step into it as a philosophical orientation toward our humanity, or whether you step into it as a theory, or whether you step into it as a professional practice model, or whether you step into it as a science model, which I'm increasingly naming my work as caring science. And I'm doing this very explicitly and very intentionally because I'm trying to get myself and us to realize that as soon as we put the human, as soon as we put caring into our model of science, we have a different model of science. And yet we have been struggling with trying to conform to a dominant model of science, which doesn't have room for the same model of intensity of our connectedness with humanity that nursing brings as a discipline and as a profession. So in stepping into this work, at whatever level we step into it, one of the first things to be aware of is that we have to be present. We have to be authentically present. And so I'm just going to take a moment for us to pause, and nurses who are using this work systematically in clinical settings are actually very intentional and very conscious about pausing and breathing and releasing and letting go so they can actually be more authentically present to another person. Because all of this, at whatever level we step into it, where this work truly lives is in those caring moments that we have with another human being in our life. And those moments inform us and the person we're touching for as long as we live. So if you'll just bear with me, and if your legs are crossed, uncross them. Let yourself breathe. It's in the evening, and so it's that time of day of transition. And just gently close your eyes if you choose to, or rest them gently. And then take a very deep breath. And as you take a deep breath, just gently hold it and then release it. And as you release your breath, just let go of anything you brought into this space. And as you breathe in, just become gently aware that you're breathing in the breath of life. You're breathing in the mystery of life. And just breathing can be connecting us with Source. Breathing in and releasing. And finding that still point that we have between the breaths. So find that still point and fall into that space and appreciate yourself and everything that you have done to bring you to this point in time. All your struggles and challenges and successes and joys and celebrations and sorrows, all of it. All of your dreams, your accomplishments. Just appreciate yourself. And gently with your mind's eye, fall into your heart center space and just visualize a light in your heart getting brighter and brighter. And as that flame expands and radiates throughout your chest, just bring to mind and to your heart consciousness a person or situation that you're totally grateful for. Just welling up those feelings of gratitude and appreciation. And just let those feelings of gratitude radiate throughout your chest. And gently bring to mind a lovingness feeling that you have for another human being or for some aspect of your life. And let those feelings of gratitude and love radiate and make that flame larger throughout your heart-centered space. And as you continue to breathe, if there's any person or situation you need to forgive, just bring that situation or person to mind as well. And with this consciousness of gratitude and love that they have crossed your path, or this situation has crossed your path, just take a moment to visualize that and bless, forgive, and release that person or situation so you're no longer carrying it. And then gently, again, continuing to breathe, just with your mind's eye, have those feelings of love and compassion, gratitude, forgiveness, filling up your heart, opening your heart, and with your mind's eye, radiate those feelings throughout this room, this space. and let them extend as far as you wish to extend those feelings and radiate them out to any loved ones, to family members, to your colleagues, to all those in the world who are suffering at this time, particularly in Japan. And then gently bring that consciousness back of that radiant light to yourself and enfold yourself with this radiant light, letting ourselves know that we are both protected and connected with this work in our world. So as you come back into this space, I'm going to do a ritual. And one of the things that I'm finding in this work is increasingly it's becoming embodied in these daily experiences of nurses. And this is a ritual that I started many years ago when I was in Sweden on a Fulbright. And I was aware that they're in total darkness 24 hours a day, 7 days a week. And while I was there, they always had candles, and it's very subtle, but very transformative. And so when I returned to Colorado and started doing my courses there, I took a candle and I had the course in a beautiful setting. And at the end of the course, this is a 5-day intensive, every student in the class had found the candle shop in Boulder, Colorado. And they came back the last day of the class, and they had a candle, and they talked about how their heart and their compassion and their caring had been ignited and reignited, and they wanted to take a light from that original candle and pass it on and take it back to them, to their setting, and they were from all over the US and Canada at that time. So I thought, well, students start this, I can't ignore it either. A ritual, you have to keep it going, right? That's part of the energy of a ritual. And so, to make a long story short though, this candle that I have lit here has been around the world of nursing groups now more than 12 times around the world. So it's a reminder that we are doing this work around the world, and I'm passing on this light of nursing from around the world to you here today and this evening, and I'm leaving this with you for your continuation of some ritual that you'll have to create here. And also the other part of this ritual is energetically, I'm taking your light with me to the next place I go. So, which is actually going to be tomorrow at Einstein, but then beyond that, I will be doing other international travels and so forth. So this is another reminder of the light, that we are the light in the institutional darkness. And it is through our humanity and the light of our caring consciousness, our intentionality, our human presence, our knowledgeable caring, that we actually are making a difference in the world. And nursing is really becoming truly the health profession of the 21st century, that we've always been on the margin, but now we're actually making this more manifest. So I'm going to be speaking about that more specifically in terms of the disciplinary foundation. So I'm going to put this aside. So while I can't see my slides, I'm going to advance them. This work actually, I can do this. This actually is embedded in Nightingale, that we already know this work. It's already in our genes at some level. And so it's a reminder of this recreating Nightingale, if you will. It takes about 100 years, it's been acknowledged, for a profession and a discipline to mature in its own right. So just the 2010, we just celebrated the International Year of the Nurse and the centenary of Nightingale, which means we're right at that vibrating turning point. We're either going to make this hard transition to become a mature human caring, healing, and health profession that we've always been on the margin, or we're going to be very good technicians of a totally transformed system, because society is already changing in the way of what they want in terms of healthcare. So my work, as more recently in the last decade, has taken on this turn from my original work of the curative factors to using the concept of caritas. And as Zane pointed that out, I use this word very intentionally because I want to make the connection between caring and love. that this work is fueled by caring and the love of humanity, the love of service, of offering compassionate human service to another human being when they're most needed. And somewhere along the way, we've been detoured away from that, and that's why, by sustaining the disciplinary foundation of this work, it allows us to advance our profession in a much more mature way. So I want to say something about a secret. It's almost a secret for me that I've had to discover, and I'm sure some of you already know this, but it's an awareness of waking up, for me at least, that there's a difference between the profession of nursing and the discipline of nursing. If we're only focused on the profession of nursing, we can lose our way because we get pulled in all those directions with all the vicissitudes of the demands of the outer world of practice without having clarity about what guides and what is the foundation that informs the profession and helps to find our way through all the chaos. I noticed one of the posters was called Caring, I think, no, Calming and Calamity. Who did that? Somebody did that poster. I just saw the words and it was intriguing to me. Thank you, because it was interesting to me to see using the word chaos versus the caring. And if you know anything about chaos theory, they acknowledge that underneath the chaos, there's another patterning of ordering if you pay attention to what's happening. Around the edges, around the margins of the chaos, you'll find new order emerging. And this is what's happening now with nursing in the world. You're finding around the edges that the public is asking for something else that nursing has always had to offer. But the other way to emphasize the disciplinary versus the professional and the combination, they're informing each other, of course, but if you don't have that foundational piece, you lose the heritage, the traditions, the values, the ethics, the philosophical orientation. So the foundation, the disciplinary foundation, is really what we use as the lens by which to see our world. And I use the word theoria for theory and its definition of theory because theoria is the Latin word that means to see. How can you do things differently if you can't see things differently? And the other part of this work is giving language to the phenomena that we are engaged in every single day, which is caring. It's human caring. And we may not be conscious of what we're doing, but what we're doing in the midst of all the actions, we're really helping to sustain human dignity. We're sustaining human integrity and wholeness for that person. So this understanding that the discipline is what holds the meta-narrative for the profession. And if we don't have the knowledge and the advancement at the disciplinary level, we get detoured off into all these other directions where we can become very good technicians, but we're not really practicing the profession and the discipline of nursing. So this caring science helps us to acknowledge that we are still caught up somewhat. Now, I don't know if you can see this. You see that? I can't see the pointer. But in any event, the center is really the hospital acute care orientation that we've had. And we are now moving very, very quickly to a post-hospital era that we have to pay attention and see the hospitals as important resources, but even within the hospitals where you're seeing the implementation of these caring science models, which are happening right here in Albert Einstein and other hospitals around the country, we're actually seeing this transformation coming largely from nurses, where we're actually transforming self and system for these authentic caring and healing practices, so that the hospitals now of the future will become caring and healing systems, not these institutional kinds of settings. And already you see all these incredible caring healing modalities and these other approaches that the public is asking for, whether it's framed under complementary alternative medicine or some other terms that we know. But we see this transformation, this evolution of human consciousness, which we're all experiencing because we're part of this. So we are beyond this role of trying to balance and do everything, which we're still kind of caught up in, as we really don't understand that underneath of this action is this silence of our presence and our consciousness and our intentionality that we hold for this deeper level of the work that we're engaged in. So this gives you a perspective of some of the evolution of my own work, which I actually have 3 new books coming out this month or this next couple of months, and some of you have one of the new ones that just out. So I don't have those on there yet, but they're also coming. So I want to just emphasize then that what is underneath this caring science and what is underneath this theory of human caring is this disciplinary foundation. And that is where you have the meta-narrative, those timeless values, that covenant that we have with humanity around the world. Those theories, their worldview, our orientation toward humanity, and the lens that we use for our knowledge, all of that is what is underpinning us as a maturing of a discipline. And so we're coming beyond this era 1 thinking of traditional science of just the body physical and all of the material body and so forth, where we're doing external things to another person and we can separate ourselves from that, to really seeing beyond the body as a machine metaphor. And in some of the ethical kind of context here, we can pause and review, or at least critique, these scenarios that we're still kind of working our way out from under, where in the first instance, person becomes patient, and then patient becomes body physical, and then body physical becomes machine, and then we get this spiraling downward without pausing and critiquing through our theoretical lens or our disciplinary lens, to where we have created a situation in the institutional mindsets where we've taken a fully functioning human being, may have some illness issues, as we all have some dilemmas here. We've taken a whole person and we have reduced them down to the moral status of an object. Now, as soon as that happens, what happens is that then we can begin to justify doing something to other as object that we would never do to them as a fully functioning person. So this too is part of this evolution of our awareness that the person is more than just the body physical. And of course we know that over these few decades we've gone through all this biology of hope and the psychoneuroimmunology and the soft phenomena of caring or touch can actually make a physiological change. But where we are moving is something that's very different. We're into what's new territory. We don't know what it is, but we know it's a new worldview that's upon us. And everything is connected, and we're witnessing it right now with the pollution and with the Japanese crisis, that everything is connected. And what's happening in one part of the world is affecting all of us. So a unitary worldview that Martha Rogers talked about is already so prevalent that we can no longer ignore it. So in this era 3, it's referred to, non-local consciousness, what it means is that we're in searching of new metaphors, because the old dominant metaphor of the body as machine, of the person as the machine, as the institution as a machine, of the organization as a machine, no longer holds in terms of our world, and certainly in the virtual world and the electronic world. So the search for metaphors, and one of the metaphors that I've used across time has been the hologram, as many others have used it. But I was at a World Affairs conference at University of Colorado in Boulder this week, actually, they've had it for about 40 years, a full week of scholars and controversial speakers and Nobel Prize winners and musicians and film studies. I mean, all kinds of exotic people from all over the world come for a full week in Boulder on campus, and they do open seminars and open talks that anybody in the community and all the students can go to. And some of these talks a couple of years ago that I was at was a musician from Canada. And he was saying that the emerging metaphor for this era is really art. And it's like, what brings us back to the human spirit to release new creative urges and new creative possibilities? Or this whole momentum that's taking us away from that localized, medicalized orientation toward our humanity. So even now we see notions of consciousness, intentionality, and our human presence is now part of new science models, and the concept of love is coming back into our science models. And unfortunately, I had a slide of this love in Boulder, where there's a new cancer center, and it's on one of the main streets where I drive by. And it is a huge side of a building, and it says, "Love Heals." And it's the Rocky Mountain Cancer Center. And you know, a few years ago, I was doing some work with Wayne Jonas, who was the first medical director of the Institute of Mind-Body Medicine, Complementary Alternative Medicine at NIH. And he was telling me the story of his interest in healing. And he had gathered together people from all these different traditions to explore with them what was the core ingredients of their approaches to healing. And he says there were two things that they could agree on. That they all practice their approaches from a place of love. And secondly, they all practice from a place of intentionality. Intending this love and healing as part of their work with another person. So this notion of love is going to come back when I go through this a little bit more, because this is 12th century artwork of Hildegard of Bingen, who was a nun, a visionary, a mystic, a saint, a musician, a poet, a writer, an artist. And one of the things she said is that the human being resides in a field of consciousness. And again, I can't see this, this pointer, but nevertheless, what I want you to see from these slides is you'll see the human form. But at the top of the head, and the body of this human is surrounded in a field, and at the top, it's open. And linking this with the ethic of belonging and this infinity of the infinite connection of across time and space is the work of Levinas. And he says, we all belong to this infinite field of universal love or spirit. And Native Americans would say we all come from the spirit world, and we're here on the earth plane for a reason. And then we return to the spirit world. And one of the Native Americans said to me, why is it we all love a newborn baby? We all love a newborn baby because they're total love. They're fresh from the spirit world. And so we welcome the newborn baby, but what happens when somebody's returning to the mystery or to the spirit world? Then we get nervous and we want to control it and make all these things, rather than honoring the sacred circle of life and death and our connectedness to this bigger field of the spirit world. So this ethic of belonging and this notion of the infinite field is used artistically and metaphorically in carrying science for me. And the other way I use this is a way to visually understand even Nightingale when she says, what is the nurse's role? Is to put the patient in the best condition by which nature can heal. It's an inner process. I was involved in a project in Hawaii several years ago, and they were developing a program to reintegrate the native Hawaiian traditions back into their healing practices in their hospital there at Queens Medical Center in Honolulu. And so they developed this project called Lokomakai. And Lokomakai means inner healing, because it's a reminder that healing is an inner process. It's not something we can treat people, certainly, but the healing has to come from within. And being in right relation is a definition of healing that I use my colleague Jenny Quinn's definition of healing, is being in right relation. So being in right relation with Source, which is love. So it has another whole way to open our hearts and our minds to the way in which we touch another human being may help to open up access for their inner healing in the Nightingale model, or we can shut that down. So if you can imagine when you walk into the space with another human being, all of the caring healing modalities we do, or even all the tasks and skills you do, in the way in which you are doing them with your presence, you can either help to open up that space for that person, or you can shut it off and reduce them down to the body physical. So we then no longer can see them as a whole person. And so when you have a human-to-human caring moment, connection, you're actually connecting at that place that meets us in that source place that we share. So it takes a while to grasp this, but it's a way to open up your hearts and minds to this work and the role of love. And this quote of T.S. Eliot I love, he says, "Love is that old, unfamiliar name behind the hands. It's not known because it's not looked for. It's hidden in the stillness behind the scenes." So when you're actually involved in those caring moments with another person, that's what you're actually experiencing, but we don't look for it. It's not known because we don't build it into our models of science. So when you put the human, you put caring, and you put love into a model of science, you have a different model of science. So that's why I call this caring science. Now, there's another science model behind this, that it's not just me making this up, although I am and have. However, there is an incredible body of knowledge that's emerging in hard science around the concept of love and heart-centered research. So more recently, with this Caring Science Institute I'm involved in, we are doing projects with the HeartMath Institute in California, where they have this whole methodology and science base around the heart-brain communication, which is acknowledging scientifically, finding and acknowledging that the heart actually sends more messages to the brain than the brain sends to the heart. So when you go into that space with another person and you've shut your heart down, you actually are cutting off part of your intellect. It's something like an 80-20% shift. So we're shutting off our source of compassion, of caring, of love, of the intelligent heart. The heart is the source of our inner wisdom, of our truth. So our very humanity resides in our heart. So if we find our way to open up our hearts more and more, we can see a new vision of humanity that unites us around the globe, so that we no longer are in these positions of reducing another person to the moral status of object and justifying doing something to other object because they're different from us. So it has a lot of implications for caring and peace. And we actually have a conference scheduled in June in Hiroshima, Japan with the Red Cross University on caring and peace, this very issue, which has now, of course, been postponed until March of 2012, which we hope to reschedule it. But the other part of this science model is showing that when you actually are fearful and when we're working from our hearts, you're working from your truth. If we're working only from our heads, we work from ego. We work from fear, control, domination, and trying to fix everything for everybody, rather than connecting with another human being. And what's happening with this research is showing that this is heart rate variability. So when you are fearful or you're frustrated and you're rushed, so to speak, this is what your heart rate looks like, the red. But what's happening is, and I've seen this calibrated like this, as soon as you pause and breathe and fall into your heart center with this consciousness of love or gratitude or these higher vibration feelings, you instantly, your heart rate variability instantly goes to the smooth lines. And it's referred to in this science model as coherence. You actually are more coherent. And not only that, this work is showing that it affects your cortical functions. So, of course, if we're all frustrated and rushed and hectic, it has safety implications because when you're in that field of coherence, when you have that consciousness, that intentionality, that human presence, of that calmness, you have this vibration of coherence. And this is actually associated with facilitating your cortical function. So you have more knowledge, you have more access to all your knowledge, your intuition, and other ways of knowing that come into play in this model. Not only that, this is the part that I love. It's showing now that when we're working from this heart-centered consciousness, you have to practice this, there is a field beyond us that can be detected 8 to 10 feet beyond us. So, you think we have responsibilities now to wake up because we're affecting the whole field around us. It's like we are radio towers. If we're angry or resentful or we're hectic or we're fearful or resentful or whatever those feelings are, and we all have them, but if we dwell on those and that's what we're communicating, then it's contaminating the field, so to speak. So nurses working in this model in hospitals now, I talk about creating a Caritas conspiracy. So what happens if you start this practice at the unit level, and nurses, where they've done it, people walk onto that unit and say, something's different is going on here. And physicians say, I think I'm going to make my rounds, start my rounds every day on this unit instead of another unit. Subtle things like that are starting to happen because it's that subtle field. And so in this model of caring science, and when you're moving into models of healing beyond just medical treatment and cure models, we have to pay as much attention to the subtle environment as we do to the physical environment. And of course the physical environment is obviously important as well. So this includes this expanded view of the human beyond the body physical machine level, to really paying attention to the fields of light and energy and consciousness that go beyond just the body physical. And then in this process of creating healing environments, we can have a different view of environments, because in a conventional view of environment, the nurse and the patient are in the physical environment together looking out into the physical field. But if you use a theory to guide your approach to environment, then you realize that the nurse is part of the environment, and the nurse, with their intentionality and their theoretical orientation, can actually repattern the environment, or help to repattern the environment, because they are part of the environment. And then if they go to another level and start offering caring healing modalities more systematically under what I call a nursing qua nursing model, in contrast to a nursing qua medicine model, then you would offer some of these other modalities that are advancing nursing practice in what might be thought of as alternative practices, but are really part of Nightingale's model. So, but a third level of environment that goes to the deeper level, the caring science, in addition to those first two, is that the nurse, his or herself, is the environment, because we're affecting the whole field. So it's a whole different way of kind of waking up and having to pay attention to our own self and our own self-evolution of this work. So the caring science is really sacred science, really is a reminder that we have this ethic of belonging, that we're all connected. This is a relational worldview, and we have this source that we can draw upon for this connectedness and for our work. So what I'm going to do is briefly go through some of the core aspects of the theory with a few examples of how this is manifesting in the world. And the first one is what I've been talking about. The foundation for this theory at the disciplinary level is making explicit that this is a relational worldview. It's not a separatist worldview. In the conventional way of looking at our world, I'm separate from you and you're separate from me, and we're separate from the environment, we're separate from nature, and we're trying to control and dominate everything around us. But in this model, it's a philosophical, ethical approach that really is guided by this other worldview of relationship. The original work, some of you may know, were there's 10 curative factors, and I made up the word curative to be a counterpoint to curative. That nursing has a responsibility to develop knowledge for its phenomena as much as medicine has a responsibility to develop medical knowledge, and we need both, and not either or. And nursing is not just an extension of medicine. It is a distinct discipline and profession in its own right that balances and complements medical treatment and cure. And so this Caritas processes then brings the heart-centered caring and compassion and the science of that behind this work much more systematically through some of the practices and methodologies and the research that are actually happening out in the field. So, but where this work lives is in the caring moment. That is that Caritas field. So the transpersonal means it's beyond just the two people, that is the whole field that's radiating in that moment. And when you connect human to human, you're both accessing that source. You're connecting to that human unity, if you will. So it's another way of understanding that we can't just walk in and do something to somebody and think it's not affecting them or us. That it's a mutuality and it's a reciprocity here. So that's why in the practice world, nurses are actually intentional and conscious about pausing before they enter the patient's room. Doing rituals such as hand washing, which we do all the time, but rather than doing this, using that as a conscious, intentional cleansing of self, of self-caring, of also consciously blessing and releasing that last patient so that you can be more available to the next situation. All of these transitions become mindful. In one of my books, Postmodern Nursing, I kind of playfully, back in the 90s, talked about the zen of hand washing and the zen of bed making. And so one of the experiences I had as a new dean was a student, a young man who came frantic to my door and in the evening, and I was ready to go home, and he was frantic because he wanted to go to the learning lab, and he had to learn, he had to be checked off on his skills, and he had a student there to be his model, but he didn't have the tutor to check him off. And I said, well, what are these skills you have to be checked off on? And he said, hand washing and range of motion. So I said, okay, I can do that. I'll go with you to the learning lab. So I go to the learning lab, and he does the hand washing, and I didn't say anything then, but now I would say something because you see my evolution. But when he started doing the range of motion, it was like the person was a bag of flour. And he's doing this, he's quick, he had to go to work, and he had a child, and you know, students are busy, and they have life and jobs, and all these things they're trying to fit in. And so I'm saying to myself, as a new dean trying to get a caring curriculum, saying, how in the world do we introduce caring in this kind of structured curriculum? And so I said to him, you know, we have to pause and be mindful about how we're touching another person. Because you're not just touching her body, you're touching her heart, you're touching her mind, you're touching her soul. And the student froze in place. He turned around and rolled back his eyes and leaned back on the heels of his shoes, and he said, I knew I shouldn't have come to the dean's office. So this is hard work to come into this consciousness, but it's that kind of turn that we're all invited to come into, because we are affecting the whole field, and that person is affecting us as well. And so it's informed by our consciousness, our energy, our energetic presence, our heart-centered presence, our intentionality. Lee Kaiser, who is a health futurist and does work all over the world with hospitals, envisioning the future with healthcare. And he says a couple things that I just love. One of them, he says, the nurse of the future will be hired because of his or her caring consciousness. Because again, back to theory, how can you see you have another consciousness when you're in this model, which is what's so important about what LaSalle's doing. For all levels of students, you see the world differently, and you can't do things differently if you can't see things differently. So when you have the consciousness, you're able to be knowledge workers and come up with new creative ways to solve problems or to be solution-seeking rather than just problem-oriented, is another turn here. And now we have this heart-centered kind of consciousness of this. It's really powerful. The other quote of Lee Kaiser that I love that fits with this, he says, when a nurse walks into a patient's room, a magnetic field of expectation is set up. It's like the patient is saying, oh, please see me, see me, see me, see me. Not just my disease, or not just my behavior, or not just my complaints or my diagnosis. See me. A magnetic field of expectation is set up. So to hold that in your consciousness when you walk into that space with another person. And so the last one of the ingredients of this theory, so to speak, that is informed by this disciplinary foundation of caring science is really getting to reframe. In this model, you get to reframe everything you're doing. You're still going to be doing whatever you're doing, but you get to reframe it in your consciousness and in your intentionality and in your presence by the way in which you are conscious of what you are doing. And so there are two layers of this. One is you do all the tasks and skills you're already doing, but now you are envisioning them and you're communicating this non-verbally and verbally to the patient, family, community members, whatever, that you're actually offering a caring and healing modality for these people. It's one layer. Second layer is now nurses are going back and reconnecting with all those caring, healing arts that we've been doing for hundreds of years across time, but they've been ad hoc. And now bringing them systematically into the practice world. If we're not doing it directly, we're making them available for patients and family members. Whether it's, I'll go back to Nightingale's model, all of these are on the blueprint of Nightingale. Auditory, visual, sensory, olfactory, tactile, consciousness, PETS, light, theory, light, form, color. Every day a patient should have something beautiful to look at, is a Nightingale quote. So all of these things that nurses have done across time, that have just been out there, that's just what nurses do, now have been systematically brought into play, somewhat because of the complementary alternative modalities. These are non-invasive, these are non-intrusive, these are these natural modalities that nurses have offered to humanity to sustain human dignity and comfort measures, pain control, symptom management, etc., creating a sense of well-being. All of these are now brought systematically back into professional practice models for advancing caring and healing practices in our hospital. The other day, one of the nurses in one of our VA hospitals in Denver, working with us, has said, she was telling the story how she was walking down the hall on the unit and a physician came up to her and he was kind of upset and he said, somebody's doing reflexology on my patient in room such and such. He says, what do you know about that? And she said, I don't know anything about reflexology. I do Reiki myself. So it's this kind of work that's happening all over the place. And so we're making it explicit. It's theory guided. And it's also scientifically guided now. So those are the ingredients of the theory, the framework, and I'm just going to briefly go through the actual Caritas processes. And the Caritas processes actually named, you know, it's been acknowledged in this postmodern era that if you do not have your own language, you don't exist. So how can you look at outcomes of caring if you have no language to even define caring, if there's no documentation of caring? So by having a theory to guide your practice and start documenting what you're doing, it changes the very nature of you're able to see what it is you're doing and look at outcomes. So we've got several projects going on around that. And the first Caritas process that brings in the values and the philosophical orientation is really the core of everything else. With all the heart science meeting caring science is the practice of loving kindness and equanimity with self and others. And that in itself is a lifelong journey for all of us and is an embodied practice for us to engage in for ourselves. We're doing projects with Northern California Kaiser system very systematically with many nurses who don't know anything about nursing theory. And we're creating these 80 nurses at a time projects where we've created stations around the Caritas processes and they get embodied experiences of these Caritas processes for themselves so that then they can actually relate it to patients. The second Caritas process is really what we're doing, what's happening when you're practicing caring, you're actually practicing loving kindness. You're helping to instill faith and hope and enable faith and hope through your authentic presence. You're actually having to be sensitive to yourself, and that allows its ongoing spiritual evolution for yourself and your own development. It allows for, that's the foundation for authentic, trusting relationships. And one of the projects that we have now is a 5-item, what I'm calling an APGAR score of caring. And we're using it in some of the hospitals that are involved in this work more systematically. And these 5 items have been factor analyzed down and done validity, reliability studies on, etc. And the 2 that are most important are the first one, which is the practice of loving kindness. Patients are asked, was your care delivered with loving kindness? That's pretty powerful to be asking patients that. And secondly, the one that's also important factor analyzed down is the trusting relationships. Did you have a trusting, caring relationship with your provider? So the other part of the relationship, which is the empirical foundation for this, that is really classic research that I love to share, because we can all relate to this, and you might remember this and you won't remember anything else I talked about. But this is work by Halldórsdóttir in Iceland, and the reason I use it is because it's classic and anybody can relate to it from any culture. And this was from patients who actually described nurses and the experiences they had with caring or non-caring with nurses. And some nurses, unfortunately, were referred to as making them feel worse. They were made them feel angry, despair, decreased well-being. They were life-destroying. There's no life force there. There's no heart there, another way to think of this. And that was referred to as bioacidic. The nurse is bioacidic. Other nurses were described as treating them as a nuisance. They were cold. And that's biostatic. They're life-restraining. They're not helping that patient access source, if you can remember the Hildegard of Bingen visual image in this. Others, nurses, were described as apathetic, detached, robotic, just going around doing the job. And that's biopassive. Whereas the more classic nurse is the bioactive nurse, but benevolent kind, etc. But the highest level of caring is biogenic, and that's what I'm talking about in the model of caring. The authentic caring science model is life-giving and life-receiving for the nurse as well as the patient. And that's when you get into transpersonal caring and this manifesting this Caritas field, and is the ultimate goal of this Caritas healing model, which is biogenic. The other thing that I'm really saying now, which I guess is kind of controversial, but I think it's unethical for nurses to work in or be conspirators of a bioacidic or biostatic environment or relationships. We can all acknowledge we're not perfect. We're going to have some biopassive days, but certainly we should be working toward the bioactive and the biogenic environments for patients and for ourselves. So some of the need for having what's referred to as habitats for healing for the practitioners as well as for the patients is critical to making this turn that's happening. And again, I've been working in this so long, and I had a dream a while back working with one of the hospitals that was probably somewhat on the biostatic or bioacidic level, but they wanted to do this caring model. And in my dream, I was following a nurse down the hall in this hospital, and I knew exactly which hospital it was. And the nurse went into the patient's room, and she had a glass of water, and she just practically threw it at the patient. It went all over his bedclothes, and then she just willy-nilly walked out of the room. And in my dream, I stopped her and said, "Wait a minute, you can't do that." And then I stopped her again. I stopped myself in the dream. And then I went on to say to her, "Do you know there's a way to give something to someone in such a way that they can receive it? It's reciprocal, it's mutual." But what I was doing in my own dream was catching myself, because we can use this caring orientation and actually be bioacidic and trying to get somebody else to be caring, if you know what I mean. It's like what do they refer to? The tyranny of niceness, or the tyranny of caring, where you can't really be authentic. And so by helping to acknowledge and catch yourself, so you're not trying to be blaming and judging and negative to another person, but you're actually offering another way to repattern that environment. We don't know what's going on with the colleagues either, right? We're all in this together. So this is kind of an awareness of how we can catch ourselves and create new patterns of working in the community of caring among ourselves. The other part of this work is acknowledging this research of my former doctoral student, Christine Swanson, who is now Dean of Nursing at University of North Carolina, Chapel Hill. And she took her sabbatical year and did a meta-analysis of 130 studies of caring in the nursing literature. And it just highlights what's happening from the Hellward's daughter research, because patients who were actually experiencing caring, there was evidence of emotional and spiritual well-being, sense of dignity, self-control. There was evidence of physical and life enhancement, lives were saved, safety, and so forth. We know this, but to have it empirically validated is pretty powerful work. Whereas non-caring patients, there was evidence in these 130 studies of humiliation, patients being frightened, out of control, helpless, vulnerable, so forth. So the question is, back to the bioacidic and the biogenic, where you have caring, you have evidence of biogenic experiences. Where you have non-caring, you have evidence of bioacidic experiences. And we also know that one person's level of humanity reflects on the other. So if the patient's experiencing that, guess what? So is the nurse. Same studies, where nurses were experiencing caring, there is evidence of this emotional and spiritual sense of accomplishment, satisfaction, gratitude, purpose, a report of the love of nursing, able to live out their own values, their own philosophy, a respect for life and death, all of these things that we hold to be the value system of the discipline and the profession of nursing across time. Where there was non-caring practices, the nurses were hardened, oblivious, robot-like, depressed, so forth. Again, bioacidic or biogenic. So the empirical work underneath this is also informing these Caritas processes. This fifth process is related to allowing for the expression of positive and negative feelings. And the way in which we can do that is by actually authentically listening to another person's story. And you or we may be the only person there listening to that person's story. And in listening to another person's story, that may be the greatest healing gift that you can give them, because they can find new meaning in their life experiences. And what happens when they have chaos and the confusion and the fear and the inside, and you create safe space for authentically listening to them and holding their tears for them, holding their story for them, they actually can take the chaos of the inside and be able to put it on the outside in safe space. And then they can start seeing their situation differently. So they come up with new options and new opportunities for themselves, rather than us, laying some kind of fix-it model on them. And some of the experiences we're doing with the Kaiser nurses are very connected to this. It's a very transformative experience of creating these experiences in dyads, where nurses cultivate this Caritas heart methodology that we're working on, that I've talked about, how it creates coherence. And then having this consciousness of honoring the privilege of listening to another person. And then one person just authentically holding the other person's story for them from the heart, and letting the person speak, and they're not speaking, they're in silence. And then they shift. And a lot of us have done those exercises, but when you do it with this science model underneath it, it's absolutely profound. And what they're finding is, if you're working with a patient and you're just authentically allowing them to take time for them to hear their story, and it's not time bound, it can be very brief actually, they report a sense of being heard, a sense of being understood, a sense of dignity. I mean, all these positive things are coming out of these experiences, even in a brief moment. Some are as brief as 3 minutes, some are 10 minutes. So this notion of authentically holding another person's story and not trying to jump in and fix it, and some of the research has shown that in medical systems, the physician interrupts patients within a matter of a few seconds after they've started a conversation of telling them what's wrong. So this is part of the process of the Caritas model, of then looking at creative problem solving. Except, you know what, I'm changing this. Because when you look for problems, you find problems, right? So I'm starting to change this to creative solution seeking. Because that's what nurses do. We're constantly creative new solutions for the processes that we're engaged in and for the caring processes, where we're working from the other person's frame of reference and creating all these opportunities for working from their frame of reference as to what they need. So there's lots of stories that you could tell about this. The seventh one is about teaching, but absolutely, teaching is now going to have to be coaching. And that's the whole big trend right now, is nurses are going to be health coaches, they're going to be healing coaches, they're going to be carrying healing models for the subjective meaning. And I was telling some of you earlier about the project I'm involved in with Press Ganey, which is the largest healthcare survey that's used for patient outcomes. But I was at a program with them at Cleveland Clinic last spring, and the CEO of Press Ganey was reporting that they have a pilot where they're changing their criteria from these objective, yes, the room was clean and the food was warm and all of that, to actually now shifting to what they're referring to as a sentiment model. So they're looking at mood, sentiment, emotions, experiences, expressions, feelings, etc. So we're trying to have them incorporate this subscale of caring items as a subscale into their patient outcomes with this new trend, so they can actually, in these hospitals where they're using the caring model, make the relationship between caring and the patient satisfaction, which there's nothing there right now around this area. So this notion of coaching and the teaching model becomes very important. I've already mentioned the importance of the healing environment. The nurses there creating this healing environment is Caritas number 8. Number 9, I was returning to and attending to the sacred dimension of those basic human needs that we've been sort of detoured away from, realizing that these are actually sacred acts. And so we're in this embodied spirit. You're not just touching the body, physical as we know. The 10th one is interesting because in the original work, people didn't understand what I was talking about because I was using big words like existential, phenomenological, and stuff like that. So in one of the hospitals, Resurrection Health actually in Chicago, they have developed a computerized documentation system to computerize and document these Caritas processes. But they couldn't get this into the computerized system, so they just said, oh, just allow for a miracle. So now I've kind of revised this last one, just allow for a miracle, so that we can be open to the belief system of other people. And indeed, it's amazing. I get emails from nurses telling me about the miracles they're experiencing in their practice. So you start looking for them, you start finding them, I guess. Now, this is just briefly, I'm going to go through this. This is about the ethics of face. I've already touched on it briefly. I'm conscious of the time. That this work is moving us then from the case, so to speak, to the face. What is the meaning? Who is that spirit-filled person behind that diagnosis? From this diagnosis to that relationship connection, from doing to this presence, to the unity of our connectedness. And I've used this Kaiser model from these industrial models to professional models of caring and healing. So, just quickly now, before I lose you entirely, I'm just going to highlight some of the examples from the practice world where this is happening. This is a hospital, Kaiser Antioch Medical Center in Antioch, California, Northern California. And Kaiser's system is systematically using this work. This is an example from a Winter Haven hospital, which is hosting this Caritas gathering next week. And what they have done is actually have identified all the Caritas processes and related it to safety, satisfaction, efficiency, best practices, etc. But what's interesting about this, they have framed these, and they're in every single patient's room, so they use it as a form of communication to the patient, to the visitors, to the community, etc., that this is our model of practice that we use in our system. So it's quite prevalent, and also what's happening is hospitals using this work are increasingly making it visible. So you have to have the culture of this visible because it's invisible otherwise. We try to make visible what has been largely invisible. This is a project at Denver Children's Hospital in Denver where we developed the attending caring nurse model. We began to, the nurses on this one unit went through this intensive with me, went back to the unit. They began to see things differently. It was a post-surgical pain management unit, very intense with medical students, residents, interns, etc. And the nurses found a massage chair and they brought it up to the nurses' station, right outside the nurses' station, you can see it in the background, and started doing massages for each other. Well, it was heretical at first. Everybody gasped, well, you can't do that. You can't have healing in this hospital. And so the nurses just kept doing it. And what happened was the children wanted a massage, the parents wanted a massage, and pretty soon the other practitioners who came on the unit thought, well, it might be kind of nice. So now this is sort of mainstream and we're doing research and so forth with this. So these non-intrusive, non-invasive modalities are core to what has been done with nursing across time, and we're reintegrating these, making systematic connections. Another project, they had more medication errors after they had introduced the barcode system than they had before. So they're using this caring theory, so they had me come and say, okay, how do you solve this problem? How do you use the theory to inform us with this situation? So what I did, I worked with this group of nurses on this one unit where they had the biggest medication errors, created safe space, so they actually were able to describe what they were doing that was doing the workarounds. They were making up new barcodes, not going into the patient's room, those kinds of things, because efficiency, trying to, the demands. But they made a commitment, and this has been written up in the Harvard Business Review about 2 months ago as an example. Not, they didn't quote this, but this is what's emerged from this. The nurses created this approach to solve the problem from the theory. First of all, the nurse giving medication would be centered and really focused, so they do that centering exercise that I've talked about. Secondly, they made a commitment that there would be no interruptions, no distractions, no phone calls, no questions, etc. And thirdly, the person giving medications would be protected. They would have on some garment, some visible item to identify them as giving medications, to the extent that you'll see a slide, I think, here somewhere, where the nurses actually are wearing these vests, which are, oops, I'm ahead of myself here, I can't find it, but they, somewhere, I thought I had it, there. They actually have the bicycle reflective vest, and this again is the Antioch, and they know, and they're using this so that the nurse and the patients know that the nurse giving medication is actually creating a safe space. So this was written up in the Harvard Business Review as an example of innovation that's happening in healthcare. So all of these other are examples of how hospitals are making this visible and doing things to change the self-and system. These are examples up in a Wyoming hospital. They're doing these teas where they're actually engaged in their reflective practice. They have newsletters. They did the blessings of the hands. This is happening in Hawaii. It's now happening at Cleveland Clinic. It's called Code Lavender. It was started by Earl Bakken, who was the inventor of pacemaker and the founder of Medtronic, the largest pacemaker in the world, and very spiritually, very spirit-minded, oriented toward healing. And for any patient who wishes to be prayed for, they do a Code Lavender. And anyone, they say Code Lavender room such and such. So everyone pauses and they send a prayer to the person in that room. And one of the physicians, a heart surgeon that I was with one of the hospitals, actually, Winter Haven, he says he prays for with every one of his patients before he does heart surgery. He says there's so much evidence now of the role of prayer that he feels it's unethical to not pray for these patients. And he gave the example of, well, what if somebody doesn't want to be prayed for? And he said the only incident he's had is one gentleman said it didn't matter to him whether he prayed for him or not. He says, but it'll make you feel better. Please do go and pray for me. So it works both ways. So this is another example of creating these healing environments. In one of the hospitals, they created quiet time. They dim all the lights. They have these signs. And it slows everything down. Slows everything down. And I think I mentioned today at noon, but one of the hospitals, it was Inova Hospital in Fairfax, Virginia, a huge system, and they had this theory as an intervention model looking at nurse retention and patient satisfaction and other outcomes. And they were federally funded to use it. It was a research project. And they had to operationalize this theory. Well, how in the world would you operationalize this theory to get federal funding? So what they did, they developed protocols whereby every nurse on every unit would have 5 minutes alone with his or her patient where they didn't have to do anything, just to be with the patient. What happened was the nurses did not know what to do or how to be with the patient for 5 minutes if they were not doing something for them. So they had to stop and back up and prepare the nurses on how to be present. So this notion of quiet time and preparing ourselves to be present is another whole thing. This is another example of the ritualizing hand washing that's come from posters in, this was at Children's Hospital, but other hospitals are now doing this. And of course, infection control people love this. And then we have a current that's right here among you with the Einstein Hospital, where Barbara Schmock and Abington, what did I say? Abington Hospital, it says it somewhere there. And Diane Breckenridge have started this amazing project that's gone over the last several years now and is a candidate for the Magnet Award, correct, for this innovation. And they have taken a surgical unit there at Abington and totally transformed the environment to a healing environment for the patients. And there you have this kind of sacred space environment is the name of the project, creating sacred space for surgical patients. So you see nurses have a lot of influence in this work. And another example is one of the hospitals there again in Denver developed these caring healing touchstones, and they're right on the nurses' station as reminders that we all have this power and this ability to heal and to create this capacity to love and heal. And everybody's invited to pick up a stone and to hold it and pass it on. And they thought the stones might be carried away, but what's happening is almost unconsciously, anybody who comes up to the nurse's station for questions, a visitor, family member, whatever, almost unconsciously picks up one of those stones and they hold it and they put it down. And more recently, they were saying that some of the physicians now pick up a stone and they hold it and they make rounds with it. And then they bring it back. It's like a grounding of this consciousness that's bringing to this awareness. The other thing about this project, you can see that basket, that's a blessing basket, is referred to. And on this unit, anyone who wishes to give a blessing or needs a blessing is invited to put their name in this basket or the name of someone else. And many people do this, including practitioners. Children put their own names in this basket. And every morning, they've created this healing room for the nurses, this little sanctuary. And the nurses go into this room with the chaplain and one of the nurses, and they take that blessing basket and they do a centering and a pause and a meditation, a prayer, if you will. And they very reverentially take out every single name in that blessing basket and do a blessing for that person, and it truly is transformative. So these are all examples of this work that's happening in the field. And I've backtracked a lot to show you some of these examples. And others are giving, to make this pause before you enter the patient's room. They have magnets on some of the doors with reminders and these affirmations to pause and to have this consciousness of your own presence, restoring the values. Others are making this Caritas Garden. This is a staff retreat, a project in Florida, where they took an old smoking area and totally made it into this beautiful staff stone waterfall feature to this Caritas garden. And creating habitats for healing, this is actually up in Wyoming. They use a lot of the Native American approaches there. Pet therapy, of course, is happening. This is in one of the hospitals in North Carolina. This is part of the Inova project up in Virginia, showing these modalities they were using are massage therapy, expressive dance, movement, imagery, music, relaxation, humor, prayer, meditation, pet therapy, and so forth. So these are modalities that nurses have done across time, but we're making them much more systematically to create this Caritas culture and to find ways back to the heart of their work. And this is a reminder, by way of bringing closure to this, of this ethics of face and hand. Another philosopher I've used is Logstrup, and he talks about the hand as a metaphor. And he says we literally and metaphorically hold another person's life in our hands. And this ethics of face, that we are the source for sustaining our own and others' humanity. So I invite you to consider this as sort of the disciplinary foundation of our evolution as we come of age for this time, 100 years into this turning point, and get to return to the light of our work and our humanity. So thank you very much for letting me be with you. So you didn't know I would fall for you so much. Late, but I'm open if anybody has any questions.
Thank you for a great presentation. Right here. Come down. I'll try not to. I'll stand. Yeah, that's good. Safe now? Okay, good. There's the whole end of life and how much energy, time, and money we spend at the end of the life process. And I'm not talking about hospice or palliative care, but I'm talking about in the ICU oftentimes. And it's a time, I mean, from my own experience, and I see it with my colleagues, that it's a time of oftentimes of detachment, because we're treating patients who are very ill at their wish, at their family's wish, which we know already that there's probably no hope that life will sustain on for any length of time. And have you done any work specifically in that area? Because it seems that the whole caring model approach in that area could actually transform our healthcare system and save, you know, not that it's all about money, but it's certainly, money is part of it. So is your work targeted in that area?
It applies to that area very specifically, and we are actually engaged in a new project in Northern California with Kaiser, which is for the long-term care situation, for palliative care, for hospice care, and also for transitional kind of care, using this very model. But what's happening is you work first with the practitioners, and when the practitioners change, then they change their practice model. So rather than changing the practice model per se, you work with the practitioners to help them rediscover the ways in which they can implement this, and they come up with some of their own solutions for changing the nature of their practices. That has economic implications, of course, because what's happening right now, I see the evolution of human consciousness around the globe, where people are hungry for a different approach to healthcare. And people are not satisfied with just a medicalized approach to their care. It's a spiritualizing approach to their care. So with that is a responsivity from the healthcare system to this whole person approach to care, whatever it is, in the curing model, or whether it's in a transitional model, or whether it's in the long-term care model. I don't know if that's quite what your question is.
Well, it just seems that with the caring model, with the energy field, if we're centered and caring. I mean, there's not always a story that can be listened to because patients oftentimes at that time cannot speak, but that we could actually influence the sphere around that particular room with that family and influence the decision making at that point.
Absolutely. And if you hear story after story from nurses, can give you examples of how this is actually happening, even though they may not be thinking they're practicing this model, but they are. They just don't know it when you're doing these kinds of things. And story after story, the way nurses are transforming those moments for dying patients. Oh, some of the stories I hear of nurses singing hymns to patients, and the family talking about how the nurse sung their husband into heaven. You know, things like that happen all the time that you don't really know about because it's behind the scenes. And when we start elevating our consciousness and bringing these moments and these stories out into the open, you become more systematic about doing this. And then you begin to identify and you name it. And then you have this new professional practice model. And that's what's happening right now. Thank you. Hi.
Well, my name's Carrie. I'm graduating in 5 weeks from LaSalle.
Congratulations. Good.
I really admire all the work that you've done, and we learned about you in class last semester and everything, but I feel like all of this does come with a lot of experience. So what would you say would be the most important piece of advice you could give to a new nurse coming into the professional field in a few months?
I would say to be conscious and intentional about your connection with another person in that given moment. And as you do that, then you can become more aware of what you're doing. You could actually take a moment of your own experience and share that story of a caring moment. And you could probably find evidence in that caring moment of many of those Caritas processes. So then you can kind of discover from the inside out that you're practicing this model, but then you can become more intentional about it, because then you can identify what actually happened in that moment. So use your own experience as a starting point, trying to be very intentional and connected, and then go back and see if you can find evidence of the theory in your practice. Good luck to you. That could actually be a research project for any level. Hi.
Hi. I'm just actually beginning clinicals in the fall, and I was just wondering, like, listening to all the experiences that you shared, what keeps you motivated, what drives you to keep on doing the work you do, to keep writing books and keep coming to universities and different hospitals and sharing your stories?
Well, I think it's the human spirit of this work is so gratifying, and to be able to think you might just touch the heart of another person that's going to touch another person is very inspiring to me, and is very, it keeps me open-hearted, so to speak, to think that you might actually be touching the heart of another person. And that's what nurses are doing. And so by engaging in this, just think about it. If just one nurse is touched by the way, their consciousness of how they're touching another person who's needing their help, their care, it's changing humanity. Each drop is affecting the whole. So it's my life work right now that I can't stop, because it's taking me. I'm not trying to take anything anywhere. I'm just kind of standing still, but it's taking me, because I'm still learning my own theory. You have to understand, I'm not there. I'm still trying to practice my own theory. It's bigger than I am. It's bigger than any of us. So this is a lifelong journey for all of us.
Thank you.
Thank you. I see, yes. No, I think we're out of time. I had a 1-minute video clip. Do you want to see it? Okay, it's a 1-minute video, a little bit over 1 minute. And it's from a hospital that was developing this kind of Caritas field. You'll see, if you can maybe dim the lights as well.
Flowers, $15. Decorative lamp, $50. $20. Massage chair, $200 to $1,000. Bucket of paint, $15. Caritas item choices for creating your lounge. There are many. A calm, healing environment on a busy nursing unit. Priceless.
Nova Hospital up in Fairfax, Virginia. Okay.
Hello.
Hi.
My name is Maurice Washington. I'm a graduate student and also one of the clinical instructors in the undergraduate program. I guess my question is, how can I, as an instructor, help educate students on bioactive styles when a lot of times in the clinical setting they're met with bioacidic behaviors, and just trying to what's the best approach in educating students to be more bioactive?
Well, it starts in the classroom, and it starts with creating a community caring among the students themselves. And so by having, whether it's in your learning labs or what I would refer to from skills labs to arts labs. So you actually use the laboratory as kind of a human studio laboratory or arts lab to learn about the art and the way how to be present, to listen to each other, to create a centering as you start the class, use circles as much as possible, help students to be engaged in self-caring practices, maybe use the Caritas processes as stations for them to explore how they would use these with themselves. And then when you're in the clinical setting where you're confronted with the bioacidic behavior, if you're at a higher vibration, you're going to affect that field. And one of the things that this science is showing, at the higher vibration field, like the loving consciousness, etc., actually will trump the negative feeling, the negative energy. And it takes a while, but you have to test this and you have to trust it. But also, you can change behavior. The nurses are, tell me these stories all the time of the bioacidic experiences where, physicians or residents or interns, all of the tension that goes with medical systems are actually abusive. And the nurses stop them and say, we don't talk to each other like that here. So it's interrupting the behavior, and you do it in a way that's, kind but acknowledging. Being able to also say things like, gosh, you must be really having a bad day to be, so upset or something like. So you can actually begin to respond to the behavior in a different way than taking it on. Other nurses talk about realizing that this is not about them, and they energetically let that pass, so they're not holding on to it. See, one of the things that you learn from this work, I've had to learn, is there's a difference between pain and suffering. You can have pain with suffering or pain without suffering. It's hard. But, for example, using pain as the metaphor of physical pain, if you have pain and you're fighting the pain, you're holding it, you're fixing it, you congeal it, and you have more suffering. If you have a negative experience coming to you and you grab onto it and congeal it, you have more suffering, right? You take it on, and it's a bigger problem. If you can become a silent witness to your own experiences and let it well up and acknowledge it and then let it go, it's like expanding and contracting, rising up and falling away, just like the breath. So by having the opportunity to catch yourself, it's called a mindful practice, it's called reflective practice, where you actually are learning how to be mindful of what's happening in the moment without always having to respond, without having to always fix something. And that's what nurses are learning with these patient experiences, with these being present in a moment. Sometimes just being quiet, being silent with the patient is one of the most powerful experiences you can give for them in terms of their healing experience. So it's a lifelong journey of experimenting with this. But once you have this consciousness, you'll find creative ways that you start responding to this. So this new book that's coming out, Creating a Caring Science Curriculum, might have some pointers on this.
I have another question back here.
Patient workload, and then we're often stressed and we're like not happy, and we're not happy to go in those patient rooms and take care of them. So what tips can you give us to transition from our outside life to, okay, we're going into this patient room right now, like how can we, like, you know, see ourselves to actually go in there and really care for these patients?
Well, this is precisely the practice that not just new students, but nurses every day are confronted with. How do they do that? And this is what this work is about, is teaching nurses how to sustain themselves, how to center, how to pause, how to be authentically present, so that you're not carrying into that room the last patient or the burden that you're carrying from another dynamic of a relationship or something. So you actually empty out, and you do that through breathing. You do that through bringing up those feelings of gratitude. It's a very specific methodology that comes with some kind of intentional practice. But where you have that starting point, and then you create a culture of that at the unit level, nurses start helping each other. One of the projects we did early on was a project called a HOT unit, Hematology, Oncology, and Transplant, a very intense technological unit for children. And the nurses wanted to create a caring and healing unit for that intensive care program for those children and their family. So they went through this program with us, and they began to use this theory, but then they introduced therapeutic touch, relaxation techniques, and music and sound and massage. Those were some of the modalities. And what happened, because the nurses all had the same cultural orientation for what they were trying to accomplish, and so in the midst of all the technology, then they started doing these gentle comfort measures or these therapeutic touch approaches, and it changes the practitioner as well as the patient. And then what happened in that particular work, which was research and was published and so forth, they actually started doing this with parents, and then the parents started doing this with the children. So it will change when you have the biogenic experiences where you're actually able to be present in that moment with another person. It's incredibly gratifying. So you get, that's what keeps nurses in nursing, are those caring moments. You have another person, but they're not just ad hoc, and you're not going to have them all the time, but you have that as your intentionality. And that's what sustains you, that's what sustains me, are the meaningfulness of your purpose. You're not just there to go through the routines of that biocytic kind of system, but to really interrupt that pattern. And if you can do it, and if your unit can make that commitment, you can totally transform that hospital, really, or that healthcare, or that unit, certainly, if not the whole hospital. And that's what's happening in these projects that are going on around the country. So you have to give voice and language to the phenomena of what you're about. I mean, whether you're a student, find the support system that is actually helping you, rather than perpetuating the negativity. If it's what you perpetuate, that's what you experience. Hello? Yes. Over here? Oh, hello? Sorry.
Hi. I've been instructed to let you know that I'm the last one. You were fabulous. Thank you so much.
Thank you.
I'm just blown away. You were really great. You had a lot of ideas and concepts that were very similar to my experience with yoga and transcendental meditation. I've practiced both of them for several years now, actually more than several years. I was just wondering if you are familiar with transcendental meditation. In fact, I had looked through one of your books that they were selling before the beginning of your lecture, and when I was going through it, I saw the word numerous times, transcendental, which prompted me to think that you may be familiar with that. I was just curious if you're familiar with those.
I am familiar with that, and to the extent that I've gone from transcendental meditation, which kept me out here, to Vipassana, which is an embodiment meditation, which is a mindfulness, body mindfulness meditation. I don't know if you know that.
Are you familiar with Maharishi?
Yes, and some of the research has been done on that type of meditation and how it affects the whole field.
That's fabulous.
Yeah.
That really ties up a lot for myself. I appreciate that.
Well, it also is, in the academic sense, this work is actually immanent and transcendent. When you are present in a given moment with another person, you're both fully there, embodied in the experience, but it also can be a transcendent experience for self and others. And that's when you're connecting with that infinite field that allows for the evolution of humanity versus the totalizing of humanity. So all this kind of fits together once you kind of get into it. Thank you.
Well, thank you again, Dr. Watson.
Thank you. My pleasure.
I think you've certainly inspired us, so I thank everyone, and again, thank you very much.
Well, it's been a pleasure to be with you and an honor indeed, and I thank you for letting me be with you. Thank you, Zane.